So welcome everyone to the Ontario Caregiver Organization's webinar series. My name is Katie Muirhead and I'm going to be your moderator for today. In these webinars, OCO brings together caregivers and subject matter experts to explore topics of interest to caregivers. We do this really to support and engage family members, friends, neighbors, really anyone who's caring for someone else and looking for more information and support. So without further ado, I'd like to sort of introduce our topic today and our presenter. So today we are presenting a talk about age-friendly communities. If you're new to age-friendly communities, they encourage us to look at how communities' physical and social environments and healthcare intersect to impact our health and wellness. So this webinar is going to discuss these characteristics of age-friendly communities and how they can apply to caregivers and caregiving to enable healthy aging in the home and community. So I'd like to introduce our speaker today, Dr. John Puxty. I see, Dr. John, you've turned on your camera, I believe. So welcome. Dr. Puxty is an experienced geriatrician, associate professor and chair of the Division of Geriatric Medicine at Queen's University, and director of the Center for Studies in Aging and Health. He has a primary interest in promoting healthy aging and wellness for older adults through his ongoing research in aging, age-friendly communities, memory disorders, and knowledge mobilization strategies. So welcome, Dr. Puxty. I'm going to turn it over to you for your presentation.
Thank you. So what I'm hoping to try and do in the next sort of 45 minutes is maybe to share with you some of the successes that we see in Ontario around the ideas of promoting health and wellness through age-friendly communities. So what I'm going to try and do is give for you an overview of some of the principles and characteristics of age-friendly communities and how specifically it might apply to caregivers and the act of caregiving itself. We've divided the session into 5 main parts. First of all, I want to review some of the information we have about caregivers and caregiving in Canada. Describe for you some of the characteristics of an age-friendly community and talk specifically about the 8 domains that we refer to based on the World Health Organization model for age-friendly communities. Give you a little bit of a snapshot of what's happening in Ontario at this point in time, and then we'll have an opportunity for some questions and answers. Okay, so certainly we know that older adults are often the recipients of care. And in fact, almost 3/4 of all individuals receiving care in Canada are over the age of 65. But it's important to appreciate that many older adults themselves are actually caregivers. And approximately 1 in 4 of individuals over the age of 65 are caregivers for someone else. And that other person, many of them, are spouses of the caregiver, but there's also individuals like friends, colleagues, or neighbors who account for 20%. They may actually be the older parents of individuals themselves who are 65 or older, or other family members, perhaps siblings, or even children. And it's important to appreciate that there's often a collection of individuals involved in that caregiving role, so that the older adult caregiver may receive some support, perhaps from children, perhaps from friends and neighbors, in their caregiving role, perhaps for their spouse or someone else. That help may be in the form, say, of transportation, it may be in the form of shopping, or it may be just simple things like someone who's willing to come in and give the caregiver an opportunity for some respite. We don't naturally think of ourselves as caregivers as a designation. We think of ourselves really as spouses, children, parents, or in-laws. We're actually doing what you should be doing because it's part of the duty of that relationship. We do know that many older adults who are receiving care would not receive as good care in the absence of their family members. And there's a cost to the individual who's supplying the care. that upwards of a third of older adults who are caregiving in some manner themselves express feelings of stress. And as many as 1 in 4 actually report that their own health has suffered because of their caregiving role. How we experience caregiving varies greatly, and it's characterized and influenced by several different factors. It may be impacted on where the caregiver and the person receiving care actually live. If an individual lives in the same house as the person they're caring for, it means they're actually on board for caregiving 24 hours a day, 7 days a week. It may make it convenient to provide the care, but it may add to additional stress. Conversely, if someone lives a distance away, they're dependent on transportation or perhaps some method of monitoring their loved one who they may feel is vulnerable or unsafe at times. That may require them relying on friends and neighbors to perhaps report back to them problems. It may require them to think about using virtual technology as a way of monitoring the situation. The environment itself can affect the caregiving experience. If there's challenges around accessibility, if there's challenges in terms of being able to adapt the environment to meet the need of the individual who requires care, that adds additional challenges. Socioeconomic factors are important as well. If the person who's receiving care is part of a rich social network, there's a multitude of individuals who may be providing some support. Hence, the caregiving role may be more tolerable for the primary caregiver. It may also depend on their previous relationship. Sometimes we find situations where an individual is the caregiver who didn't necessarily have a strong relationship with the individual, but because of situation, they live in the immediate locale. Perhaps they don't work, so are available during the day, makes them the primary caregiver, even though there may not have been a strong relationship. And obviously, if there's other responsibilities falling on the part of the caregiver, that can impact on their comfort level or even stress levels in terms of providing care. We talk often about the idea of the sandwich generation, the problem that individuals may have other generations, younger children, who themselves have needs. We're seeing this issue emerging at the moment in terms of the pandemic, where children are not able to go to school and parents are having to provide support to them in their schooling, but that parent may have been a caregiver actually of another individual, perhaps the grandparent. So it creates some stress on the individual in trying to meet these multiple roles. And over time, the intensity and duration of the caregiving may itself be a factor that influences the experience the caregiver is finding. So it's important, as we know, that many caregivers, their goal underlying their care is to try and keep their loved one or their family member or their friend actually in the community and in their own home, which of course is where most people actually want to age. We want to age in place. And age-friendly communities are built on that premise as well. They seek to support active and independent living and to keep people in the community. So there's a consistency in which age-friendly communities and caregivers are working together towards the same goal. So what is an age-friendly community? It's a community where often a committee, which may be a committee of the local municipality, it may be a committee of a local stakeholder group like a seniors association or a council of aging. It's often a party of stakeholders like business suppliers, community care, public health, and older adults coming together to try and create in their community appropriate social and physical environmental structures and associated programs and services that are inclusive that will meet the needs of older adults, whether the individuals are living alone or in a family, whether the individuals are socially advantaged or in fact under some financial challenges, whether the individuals were born in Canada or whether they are actually new Canadians who've immigrated later in life to Canada. So the intent is an age-friendly community should be inclusive and meet the needs of all older adults. Accessibility is really important in terms of creating an environment in which we can freely walk and exercise and enjoy social networking. It's important that there's opportunities for all older adults to participate, not only to receive services, but to contribute. And it should meet, as I said, the diverse needs and values of the community. It should promote active, independent living and enhance the well-being and quality of life. But it's important to realize that age-friendly communities are not just for older adults, but do actually meet the needs and values of all individuals. For example, buildings and streets that are free of physical barriers, they'll enhance the mobility and independence of all individuals who may have some physical challenges or disabilities, regardless of age. If a neighborhood is safe for an older adult, it's usually safe for children as well in terms of being outside. If you're aware of community and health services, which is part of the mandate of age-friendly communities, and those services are accessible, it's much more likely that you're going to be less stressed in knowing that your loved one is receiving some services at least part of the week so that you can enjoy other activities at that time. Older adults themselves contribute greatly to the community. If we look at the age representation of individuals who volunteer time, energy, and money, older adults are disproportionately represented. So we are actually finding that an aging population is an aging population with more volunteers and more resources who do contribute to the community. A number of older adults have advantages in terms of financial security, and they bring a whole new series of customers and clients to local businesses and communities. So an aging community with age-friendly principles can actually benefit the community in a variety of ways. Now, we usually divide the domains or characteristics of an age-friendly community into 8 separate buckets. And this is really based on work that's been done internationally and led by groups through the World Health Organization. And basically, we break those buckets into 3 main groupings. First of all, the physical environment. And by that, we include things such as the housing that individuals live in, the transportation that they use to travel within their community, and their outdoor spaces and buildings, things such as parks, etc. So the physical environment is made up of those 3 particular characteristics. We then cluster the group of social economic, and that includes usually social participation, the ability of individuals to participate and freely network within their community, respect and social inclusion, which may include things like intergenerational connectivity, and civic participation and employment, under which we also include opportunities for volunteering. And the third last cluster is the inclusion of information and communication strategies and access to communities and health services. So I'd like to give you some examples of active activities that are happening already in Ontario within age-friendly communities relevant to each of these 8 domains. So when we talk about outdoor spaces and public buildings, we're talking about the opportunity to be able to openly access the environment. This might include in the winter, simple things like snow clearance and ice removal that enables you potentially to access your community and walk. In the spring, summer, fall, opportunities to enjoy parks. And that again includes accessibility, but also includes things like having accessible chairs where one can rest, perhaps with shade, having opportunities for individuals to access water and toilets. In terms of our cities and our towns and our communities, the ability to actually access without a barrier, for example, of a step or a ramp that may preclude you from entering that building. So there's been an initiative over a number of years in a number of communities of creating portable ramps, like you see in the picture here to the right. And these ramps are made available to businesses, in some cases by renting, in some cases by a loan system. In this particular case, they're made locally in the community, and they're made from recyclable materials, and they're bright, colorful, so easy to see. And these ramps can enable someone, for example, with a wheelchair or using a walker to actually enter the building. And otherwise, there would be a barrier. Transportation is important. This can include having accurate knowledge about local opportunities in terms of busing, having buses that are potentially wheelchair accessible, having opportunities to enjoy cycling, for example. So in the community, having these areas that all generations can use as an opportunity for both recreation and transportation. Housing is very important to individuals, obviously, and we often hear of the challenges around finding affordable housing. So a number of communities have taken initiatives to put together inventories or directories of potential housing options within their communities. A number of communities have also looked at opportunities for home sharing, where an older adult who maybe owns their own house but is finding it somewhat challenging to afford or maintain that property might share with another older adult or perhaps students so that they can benefit mutually from some mutual sharing of the responsibilities and finances, and also companionship, which is ever important. Housing adaptations are another area where individuals' quality of life can be improved. Sometimes that can be a challenge to afford. Sometimes it can be a challenge of not knowing about available options. So a number of communities have put together simple ideas and how-tos that people can use. We thrive when we have social networks. That's one of the challenges, obviously, of this pandemic, in that our normal networking processes has been disrupted. There are numerous examples of communities who establish very innovative ideas. For example, on the slide to the left, you see an example of how a group of senior students are being mentored in French, the French language, by an older adult. A number of our community centers are no longer able to open at this point in time, but there's been a number of initiatives put in place to create new opportunities for that. Ideas around senior centers without walls, where groups still network by telephone, by Skype, by Zoom, and try to bring together some of that communication and networking and participation, even if you can't physically get together. Respect and social inclusion, important for all individuals at all ages, particularly important though for many older adults. There have been a number of initiatives we've seen. I mentioned already the idea of intergenerational connectivity, bringing individuals who are currently at school, programs like GrandPals, which seeks to connect students at grade 4, grade 5, grade 6 with older adults as role models and peers. Activities like age-friendly businesses, where programs are run which provide information and education to people who work in local businesses. So they're aware of some of the challenges and also strengths of older adults who are an important user of those resources. That might include sensitization to issues of impaired hearing, for example, so that they can communicate more effectively with the older adult. Another example of this is the Blue Umbrella program, which has been organized in Ontario in several communities by the Alzheimer's Society Ontario. And there they run an education program which targets businesses, groups like banks, shops, etc., and provides them with information and education about the unique needs of often older adults with cognitive problems like Alzheimer's disease. It helps improve their awareness, it helps improve sensitivity, and reduces some of the stigma that otherwise those individuals and their caregivers might be aware of. A number of us, as we approach 65, may not choose to or may not be able to actually retire as we had originally planned. So employment opportunities are important for financial security for those individuals. Employment opportunities for older adults also are beneficial to businesses. It preserves some skills that otherwise might be lacking in that community. It also preserves the opportunity for the older adult with experience to potentially mentor and help the younger employer as they enter into a new career. I mentioned volunteerism, which is really important to many parts of our communities, which older adults contribute to. For example, in healthcare, upwards of 40,000 hours of volunteer time are supplied by older adults annually in an average hospital. That's a crucial resource to the hospital. Older adults also contribute financially, another largest sector of donating funds to a number of organizations and groups. One of the barriers, or can be a barrier to healthy aging, is a lack of knowledge about resources, materials, and opportunities that exist within a community. So a number of communities have taken on the responsibility of preparing targeted newsletters and information resources that can be delivered perhaps as part of a daily newspaper, maybe posters that are put up in common areas like libraries or at the family physician's office. But giving older adults important information about a number of the resources that they may potentially need to access. Some communities have taken it upon themselves to develop things like making the right call cards, which list important numbers and again can be distributed within the local newsletter. And it could be things that can be posted up on a poster board or perhaps on the fridge so that when the individual needs the service, they have that information available to them. Community supports and health services are all important. Many older adults age well, but however, a significant subset do have health and physical challenges. So knowing who to turn to and how to access those resources is important, but also being accessible. So unfortunately, some hospitals, some physician's office, some dentist's office, they may not be as accessible as we want them to be. So there's been information and education provided to those services to try and improve and make their services more accessible in the same way as we try and make other parts of the community and businesses accessible to the individual. Are we making a difference? Well, we have some evidence to suggest in Ontario that we have been making a difference in terms of improving our communities and making them more age-friendly. So I work with a group of colleagues around what's called the Age-Friendly Outreach Program for Ontario. We actively work with over 70 different communities across Ontario in terms of providing information and resource and support and sharing ideas and innovation. One of the things the communities have committed to is to complete an annual survey, which we've been doing for several years now, and we've been tracking changes in terms of services across the 8 domains over time. What we're noticing in terms of our most recent survey was that there is evidence that, for example, in 70% or more of those communities, they felt there was more educational programs. In some 76%, they felt there was more recreational programs. 50% felt that seniors were being treated with more respect, and nearly 2/3 felt information was more accessible. They'd noted improvements in almost half of transportation options and access to transportation. Now, it was a lower percentage, only 19%, who reported increased range of housing options. That's not that there weren't activities underway, but to make a major change of housing often requires significant investments of money, time, planning, perhaps alteration of local bylaws to allow certain innovative housing options to be implemented. So it's not surprising that after 3 to 5 years, still a relatively small number of communities have managed major changes in this area. But perhaps very important to note is that almost 60% felt they had better access and better awareness to local health and wellness programs and support services. So we have evidence that here in Ontario, the 70 plus communities that have been active in age-friendly activities for the last 5 to 10 years are making a difference. And that difference across the domains is resulting in improved accessibility and mobility and safety for older adults and other age groups. That's associated with improvements in healthcare outcomes. For example, a reduction in the rate of falls, an improvement in the individual's physical strength and mobility, a reduction in infections as a result, improved engagement in the community, and improved feelings of self-worth and financial security, which in themselves help to reduce isolation and reduce the risk of depression. We're seeing a better awareness of community supports and increased access and use of those resources. Overall, this is contributing to improvements in aging across Ontario. This is likely to be a benefit to caregivers as well by mitigating some of the challenges that they might otherwise have to have responded to for those older adults. At the moment, we have some 73 active communities with age-friendly initiatives underway. We keep track of those communities. As you can see geographically, they're spread across Ontario. They're present in the east, the south, the west, and the north. There's representative activities in small urban and rural communities, as well as medium and large communities. And each of these communities has a range of initiatives underway at this time and are continually adding to those initiatives over time. Information about these initiatives is available on our website. And this is an important resource because what we want to do is to share ideas and innovation. Because if communities are aware of other initiatives, which may not be geographically close to them, there's an opportunity to learn from each other and to mutually support and share innovation. Specifically, in the last survey that we did of communities across Ontario, almost 2/3 identified their desire to focus on caregiver groups in their future planning and implementation. So this is a resource that caregivers should be looking towards within their community and helping create and add to. In terms of contacting your local age-friendly community initiative, I'll give you the details in a minute, but contact our knowledge broker, Lisa, who's here on the call today. There's information, as I mentioned, on the website, which can be accessed by www.agefriendlyontario.ca. As I mentioned, there's an ability to access interactive maps, which showcase the types of the community sites and the types of activities being implemented. We've been able to work with communities to create a series of regional age-friendly networks, which include groups working in the north, the south, east, and central areas. These networks meet 3 to 4 times a year, and a variety of groups and organizations join together to share their ideas and initiatives. As I mentioned, if you have questions you want to ask of communities that are currently involved in age-friendly initiatives, you can access resources and tools and information from the website, www.agefriendlyontario. If you wish, you can join our distribution list. We produce a monthly newsletter most of the months of the year, and we're happy to send that to you or to the group or organization that you belong to. And as I mentioned, Lisa, who's our knowledge broker, is accessible by phone or email, and we try to make a commitment to get back to people within 1 to 2 working days to try and respond to their ideas and questions. And it's Lisa's role to try and connect people, ideas, and resources, so she's knowledgeable about the various initiatives across Ontario, and she's a resource, we hope, that communities can pull upon as they seek to move forward in their age-friendly initiatives.
Thank you so much, Dr. Puxty, for
Pleasure.
A really wonderful presentation. Hopefully this helped folks on the call today to better understand what age-friendly communities are and do and how to get involved if they want to.